Dear elderly people, after we have explored together 10 golden keys to proactively prevent heart attacks, there is one more skill that I believe all of us, not just those with cardiovascular disease, need to equip ourselves with. That is the ability to recognize early symptoms of heart attack. Because in these emergency situations, time truly is gold, even life itself. So we need to clearly understand the nature of a heart attack to know fear and prevent it. It is not just a simple chest pain. Imagine the heart is the center of life, nourished by a network of coronary blood vessels. A heart attack, or myocardial infarction, is an acute event that occurs when a coronary artery branch is suddenly completely blocked. The common cause is the rupture of atherosclerotic plaques, accumulation of fat, cholesterol, adhering to the vessel wall, triggering the formation of a blood clot that obstructs the vessel. Immediately, the heart muscle area supplied by that vessel branch will suffer severe ischemia, leading to irreversible damage and necrosis if emergency revascularization is not performed. This is the tragedy of myocardial ischemia. For the elderly, this risk is particularly high. The aging process causes blood vessel walls to lose their flexibility, become sclerotic, and more susceptible to invasion by atherosclerotic plaques, increasing the likelihood of sudden blockage. Why is recognizing the early signs of a heart attack so important? When a coronary artery is blocked, the heart muscle begins to lack oxygen and nutrients. The longer it is left, the more widespread the affected heart muscle becomes, and the damage becomes more severe, even irreversible. Early recognition of heart attack symptoms and prompt emergency action can help quickly restore blood flow, save the endangered heart muscle, minimize complications, shorten recovery time, and most importantly, increase the chances of survival and preserve quality of life later on. Every minute that passes is extremely precious. So, what are the warning signs of an impending heart attack? Below are the typical symptoms that you need to pay special attention to. Chest pain or discomfort. This is the most common symptom. The sensation can be heavy chest, chest tightness, a feeling of pressure, squeezing, or fullness in the center of the chest. The pain may last for a few minutes, or go away and come back. The pain may spread to the neck, jaw, shoulder, usually the left shoulder, or down the arm, usually the left arm. Shortness of breath. A feeling of breathlessness, shallow breathing, may occur before or along with chest pain. Sometimes this is the only symptom, especially in the elderly or diabetic patients. Cold sweat. Profuse, unusual sweating, cold and clammy skin, even without strenuous activity or hot weather. Nausea or vomiting. A feeling of discomfort in the stomach, wanting to vomit or actual vomiting. Dizziness, lightheadedness, or fainting. A feeling of the head spinning, unsteadiness, or even loss of consciousness. It is important to note that symptoms of a heart attack are not always as dramatic and typical as described above, especially in the elderly and women. Sometimes the signs can be very vague and easily overlooked or mistaken for other medical conditions. Unusual extreme fatigue. Feeling exhausted without a clear reason, lasting for many days. Pain in other locations. Instead of typical chest pain, there may only be pain in the back, especially the area between the shoulder blades, the epigastric region, easily mistaken for stomach pain, or only in the jaw or neck. Prolonged indigestion, persistent heartburn unrelated to meals. Sudden anxiety or restlessness without a clear cause. Because of this atypia, many elderly people are often complacent, thinking these are just old age problems or common minor ailments. Never be complacent if you experience any of the above symptoms, whether typical or atypical, especially if they appear suddenly, persist, or recur. What to do immediately when suspecting a heart attack? When you or a loved one suspect signs of a heart attack, act quickly and calmly according to the following steps. Stop all current activities immediately. Sit or lie down in a comfortable position. Call emergency services, phone number 115 in Vietnam. Do not try to drive yourself to the hospital or ask family members to take you by motorcycle, as it can be dangerous on the road and delay professional emergency care. Clearly describe the symptoms and address. While waiting for emergency services, if aspirin is available, 81 mg or 100 mg dose, the type used for cardiovascular prevention, and the patient is not allergic to aspirin, has no history of gastrointestinal bleeding or other contraindications, have the patient chew 1 tablet. Aspirin helps thin the blood and can limit heart muscle damage. Note, it is advisable to consult a doctor about this in advance during regular checkups. If the patient has nitroglycerin, a coronary vasodilator, prescribed by a doctor for coronary artery disease, it can be used as directed. Loosen clothing to make breathing easier. Keep the patient as calm as possible. Remember, every second is precious. Acting quickly and correctly can save a life. Dear elderly people, we have gone through a rather long but extremely meaningful journey together. From understanding heart attack, heart pain, and its underlying risks, exploring the 10 crucial golden keys for proactive prevention, to equipping ourselves with important knowledge to recognize early symptoms of heart attack, symptoms of a heart attack. I hope that today's sharing has helped you realize an important thing. Protecting your heart, how to avoid a heart attack, is not something too distant or complicated. It lies in the very choices, the small but conscious adjustments in our daily lives. Your heart health can absolutely be within your reach if we are truly determined and persistent. So, after listening to all of this, I earnestly call on you. Don't just listen and leave it at that. Start taking action from today. Choose at least 1 or 2 golden keys that you feel you can implement immediately. Perhaps starting with a 15-minute walk each day, reducing a little salt in your meals, or turning off your phone an hour earlier before bed. Small steps will create big changes over time. Please share this video with your loved ones, especially friends and colleagues who are also in their senior years. Knowledge is for sharing, and spreading this useful information is also a way for us to build a healthier community together. Turn this knowledge into habits. Consistency is the key to success. A few days of healthy eating or exercise will not be enough if we then revert to our old lifestyle. And finally, always remember that you are not alone on this journey. Talk to your doctor, seek support from family and friends. Your heart has worked tirelessly to sustain your life for so many years. Now is the time for you to give it the care and love it deserves. It is never too late to start a healthier lifestyle, to heal, and to protect your heart. Thank you sincerely for your time and attention. Please look forward to the next videos on our channel.